Hello, everybody. Welcome to our Teletownhall with Dr. Adil Shamji, where we're going to be talking about getting a family doctor for all of us. My name is Anushka, and I'm going to be your facilitator for the evening. Tonight's town hall is a very exciting event because it is the first of many by Adil Shamji's leadership exploration team as Adil tours the province and continues to announce new and innovative policy ideas for all of us. Tonight's topic of conversation, as you know, will be healthcare. Adil has introduced a policy idea to get a family doctor for all of us here in Ontario. We're going to be taking questions from all of you participants over the next hour or so. So give a little think to what you would like to ask Dr. Shamji. A couple housekeeping notes before we kick off here. To ask your questions, please dial *3 on your keypad. That's dialing *3 on your keypad, and then you'll be able to be added to the queue and you can ask your question live. If you prefer that I ask your question for you, that can also be arranged. You'll still dial *3 on your keypad and you'll be added to the queue where you will be able to submit your question. So without any further delay, I'm going to turn it over to Adil to introduce himself and to tell us a little bit about his policy for a family doctor for all of us. Adil, are you there?
I sure am. Good evening, everyone. As you heard, I'm Adil Shamji. I am the Member of Provincial Parliament for Don Valley East. I'm the Ontario Liberal Health Critic. And what I'm most proud about is I'm also a family and emergency doctor. You may have also heard that I'm exploring running for leadership of the Ontario Liberal Party. And it's actually within that context that I'm speaking with all of you tonight, because over the last few months, I've been crisscrossing across our entire province, listening to people and trying to understand their concerns. And by far, one of the biggest worries that I've been hearing from everyone in Ontario is that they don't have a family doctor. And that fits with what we're hearing, in all the statistics. Get this, 2,200,000 people in Ontario, almost 20% of our population, doesn't have a family doctor. And what's even worse is that we're moving in the wrong direction. It's estimated the Ontario College of Family Physicians predicts that by 2025, it could be 3 million of us. And so something very clearly needs to be done. And it needs to be done because having a family doctor, as we all know, is just so important. It's important for preventing illness before it arrives. It's important for promoting healthy lifestyles and allowing us to have physical, emotional, and social well-being. It gives rise to trusted, lifelong relationships and triage and referral of medical problems before they get too bad. And of course, whenever we're all sick, if we have a family doctor, we've got someone trusted that we can turn to assess and provide, treatments and medications to make those illnesses go away, especially as we have an epidemic also of mental health and addiction problems. Family doctors are an important part of that solution. Unfortunately, for far too long, especially under this government, we haven't been hearing solutions that will work for all of us, solutions that can get everyone in Ontario a family doctor. And that's why I put my nose to the grind. And I thought and came up with a costed, thoughtful solution that will get all of us a family doctor within 6 years. And so here's the plan. It has 3 pillars. The first pillar is that we need to recruit more family doctors. The second is that we need to support more of the family doctors that we already have. And then the third is that we need to implement strategies to retain family doctors so that they don't leave and turn to other professions or retire early. And here are the details. We need more family doctors, but we need to make sure that we recruit them not just to Ontario, but to the right places in Ontario. And so my plan calls for a province-wide strategy that uses input from doctors, from patients, and healthcare stakeholders to make sure that we predict where the challenges are the greatest in the province and how we can forecast where problems are expected to get worse, and then maximize the family doctor resources in those parts. We'll rapidly expand the credentialing of foreign-trained family doctors and other kinds of doctors who are already here in the province, but are just waiting for someone to allow them to practice by checking their credentials. And we'll expand the incentives to allow physicians and medical graduates to choose family medicine in underserved regions. Now, when we talk about supporting family doctors, one thing that has always shocked people that most people don't know about is one of the biggest problems for family doctors is doing work that they don't need to do. I'm talking about paperwork, red tape, administrative things that someone else could do. In fact, by some estimates, every year in Ontario, there's about 20 million hours of administrative work that family doctors do, which could be better spent on seeing patients. So my plan will eliminate that by 10%, which it would essentially be the equivalent of adding 2 million visits in Ontario, or almost 450 new family doctors alone. We'll also make it easier for family doctors to be able to to streamline their referrals for specialists, tests, and services, doing things like using integrated medical records. And then the final pillar is that we already have lots of doctors, but after a pandemic that has pushed them to their limits, they're experiencing mental health challenges and burnout like never before. And so we need to implement strategies that can help to address those things, to keep them happy and healthy so that they can keep us happy and healthy. So I'll develop mentorship and shared care programs for new and old family doctors to work together and support each other. We'll bring back retired family doctors through special incentives. We'll implement expanded programs that address those mental health challenges and burnout that I was talking about earlier. And then we'll allow family doctors to get paid in ways that work better for their style of practice. Now, the final thing that I want to say is that family doctors work best as part of a team. And even though my policy is called a family doctor for all of us, we can't forget that nurses, nurse practitioners, social workers, mental health workers, all of these vital healthcare workers play a massive and vital role to our healthcare system. And so this plan will expand access to team-based care, which will not just give better quality care in the province of Ontario, but provide an environment that will make more family doctors want to work here. Now, this will require time, effort, and money. It's a bold plan, and I costed it out. By my estimates, it will cost about $875 million over 6 years. But we just received billions of dollars in federal health transfers from the federal government. And the Ford government is estimated by 2028 to have tens of billions of dollars amassed in what they consider to be contingency funds amassed from underspending in healthcare. And so $875 million can be easily found within those two things, within those two pockets. And the most exciting thing to me is this isn't just a policy that will spend money. It will save a lot of money as well. By my estimates, it will save nearly $400 million in emergency care alone, and is expected to save much more in the years down the line. And so I'm really excited and really proud of this plan. It's a plan that will get a family doctor for all of us.
Adil, thank you so much for that overview. What an exciting policy idea. We have almost 3,500 folks live online right now, and some questions are already rolling in. So a reminder to all our listeners to dial *3 to ask your question at any time. Let's get started with our first question of the evening, which is from Jamie. Jamie, what's your question for Dr. Shamji?
Yes. Hi, good evening. Thank you for taking my call. Can you hear me?
Yeah, Jamie, I can hear you loud and clear. Thanks for chiming in with your question.
Okay, perfect. Thanks. Yeah, so my question is this, is that since the 1980s, there's been numerous studies done on autism treatment. The treatment is intensive behavior intervention based on the principles of applied behavior analysis known as ABA. What my question is where do you stand regarding on putting autism treatment into the Ministry of Health, which should be delivered through OHIP coverage, and that way people are using their health cards instead of their Visa cards.
Jamie, I really thank you for that question. The autism program is something that is a cause that I've taken on and have been championing very closely in collaboration with the Ontario Autism Coalition. I have a province-wide petition that's going right now, and you can Google that online, because we are seeing, a wait list of I think it's now over 62,000 people that are waiting for funded therapy. And we were beginning to make progress on that by allowing families with children who have autism to actually get access to those services, to get access to some of that ABA therapy that you were just talking about. And then all of that fell to the wayside under the Ford government. And so I support the efforts that we were that we were on right up to the Ford government, and we're now going in the wrong direction. As to whether it should be under the Ministry of Children, Community and Social Services or the Ministry of Health, I think it's up to the autism community to tell us where they think it's better. Regardless of whether it's one ministry or the other, it should be funded by the Ontario government, and this Ford government is not interested in doing that. I think having a family doctor, my plan, a family doctor for all of us, can help to navigate some of those challenges that autism families are experiencing in access to those social services. And so I think what we're proposing is an essential first step, apart from the fact that I do agree with you that autism services should be funded by the Ontario government and under OHIP.
So much for that question, Jamie, and thank you, Adil, for that answer. We're going to go to an online question next. The policy you are proposing says it costs in excess of $800,000, but what are the potential cost savings to our hospitals? Is that factored into your plan? From David from Windsor. Aldo, what do you think?
Yeah, no, thank you very much for that, David from Windsor. I think I already touched on this. Just to begin, we know that an ounce of prevention is worth a pound of cure. By my estimates, we can save, easily $400 million by keeping people out of emergency departments, by allowing them to access family doctors for issues that family doctors can address best. But I think the actual savings are significantly more than that, because right now what we're seeing is people trying to get access to a family doctor, to make sure that they can get tested, to make sure that they don't have breast cancer or colon cancer, to make sure that their blood pressure and their cholesterol is under control. And if you don't have a family doctor, you can't do those things. And if those tests don't happen, then unfortunately, people don't know until they're really in trouble, until what could have been caught in a mammogram turns into an actual breast cancer that's felt as a lump, leading to costly surgery and potentially poor health outcomes that cost our healthcare system more ultimately. And so we're talking hundreds of millions of dollars in savings right up front. But the savings aren't just about money in the short term. It's about saving money in the long term. And ultimately, it's about saving lives. And having a family doctor is very literally a matter of life or death. It's why it was so important for me to address this as one of my first policy proposals.
Amazing. Thanks so much, Adil. A reminder to everyone listening in that you can ask a question as well. You just have to dial *3 and you'll be added to the queue. That's dialing *3 and you'll be able to ask your question. Before we go on to our next question, we actually have a question for you. We're going to be doing a little poll. The question we have for you is, do you have a family doctor? Yes or no? You'll dial 1 for yes and 2 for no. The question, once again, is, do you have a family doctor? You'll dial 1 for yes and 2 for no. Please, everyone, go ahead and dial right now what your answer is. Very curious for these results. They're rolling in right now. I can see them rolling in. So remember, you're dialing 1 for yes, 2 for no. And the question is, do you have a family doctor? All right, I can see the numbers coming in here. We're going to wait for this result. And in the meantime, we're going to go on to our next question. Our next question is from Rajwinder Shoker. Raj, are you there?
I'm still here.
Hi. Go ahead and ask your question.
Okay. I just have a question. I don't have a family doctor. I have it before, but I'm looking for another one right now. So, of course, everybody know that we are short of doctors, and I'm just concerning. I work in school, and my kids is just finishing high school and going to university. I noticed that, as a teacher, you should be telling your kids, little bit push, what you should be. Like we can produce so many doctors from our citizen from this country, and then when teacher don't find out how's that gonna work, and they send it to counselor, and counselor say whatever you like, you can take this course and go ahead. But sometimes I feel it for my raising my kids. If you push a little bit, I know we want to go easy a little bit with the kids, but still with the easy, you can write your future if you push a little bit to your kids and saying that you can study this and we can have a bright future, good future. We have good doctors. So, and other thing is internationally, some doctors are here, but they don't practice this because of everything is increasing, their renters and everything, so they have to work odd jobs. They cannot pursue the doctor career. So this is my little bit concern to whoever everybody's listening here as a parent. Thank you very much.
Yes, thank you. Thank you so very much for those two really important questions. I want to start by touching on the second question where you were speaking about the challenge that we have of foreign trained doctors who can't get licensed here in Canada. And actually by some estimates, you're not going to believe this. We're talking about 2,200,000 people not having a family doctor. And by some estimates, there are 13,000 foreign trained doctors that aren't able to practice here in Ontario. I know in my riding of Don Valley East, there are hundreds of doctors who have immigrated here, who we've welcomed with open arms as immigrants, but then haven't allowed to practice their trades. And I mean, Rajwinder, when your children see or hear those stories, how can they be inspired to go into a career like medicine? And how can we possibly talk about addressing the shortage of family doctors when we've got these doctors here that we aren't allowing to practice in the midst of a healthcare crisis? And so, a really important part of my plan involves finding those international trained doctors, and they want to be found. They're out there, they're trying to get licensed. But when they go to our licensing body, the College of Physicians and Surgeons of Ontario, there isn't a program that welcomes them in and streamlines the process by which they can have their credentials reviewed. Instead, what many internationally trained doctors are finding is that they have to write exam after exam after exam, only for the right to be able to redo their residency in the first place. And even if they decide that's what they want to do, it becomes almost impossible for them to find a residency position. And meanwhile, at the same time, this year, when we were doing our match for medical students to choose their specialty, we could barely fill. In fact, the first time around, there were, I think, over 200 family medicine positions that didn't get filled, and they're internationally trained doctors who could help us with that. There are ways that we could rapidly assess the credentials of these foreign trained doctors, and many of them would be suitable to practice in our province and clear the backlog without even having to repeat their residency. And my plan allows for that. In fact, it doesn't just allow for that, it accelerates that, and it has specific funding that is dedicated to that. And in fact, I talked about this plan taking around 6 years to get everyone a family doctor. Well, obviously, I want it to happen even faster than that. And one of the essential ways is to take the massive talent pool of qualified doctors that we have here, recognizing their credentials and allowing them to get work right now for all of us.
Thanks so much, Adil. We have 4,500 folks on the line right now. So welcome to all of our recent joiners. Just a reminder to everyone that you can ask a question for Adil as well. You just have to dial *3 and you will be added to the queue. So just dial *3 at any point and you will be able to ask your question. So before that last answer, we did ask a poll. We asked all of you a question. Do you have a family doctor? And we've got back some results. 82% of you said yes, and 18% of you said you did not. And this is pretty consistent with stats. That means about 1/5 of you do not have a family doctor. So really underscores the importance of this conversation tonight. So with that, we're going to move on to our next question. Our next question was an online submission from Janet from Minden. Janet says, I live in a mostly rural community, and our hospital is where most people go for day-to-day health care. Does your plan include keeping rural hospitals open? Adil, what do you think?
Okay, so this is really interesting. I think I heard that our caller is from Minden, and as people may have heard from the news, Minden faces a closure of their emergency department. Actually, today is June 1st. I believe it will have closed today. Again, another example of how our healthcare system in Ontario is moving in the wrong direction. Now, the thing I have to say, especially in communities like Minden and other ones outside of Toronto, family doctors are the backbone of that community's healthcare system and of those hospitals. And having an adequate number of qualified family doctors, and not just the right number, but the right number in the right place, because we can't just have them concentrated in Toronto or in Ottawa. Having the right number in the right place will absolutely help immensely to keep our hospitals open across the entire province. Now, one thing I did want to comment on, just in regards to the last poll that we had, where we saw 82% of people saying they have a family doctor, and actually that the results are still actually coming in. And thank you everyone for your participation. So it's 80% now are saying that they have a family doctor, and 20% are saying they don't. That's 1 in 5 people. And you know what's really tragic about that? We're all paying for a family doctor with our taxes. We deserve a family doctor, and our healthcare system isn't delivering one. But the other thing that really strikes me is even for those 80% of people who actually have a family doctor, we don't have this poll loaded up, but I'm curious, when I think about it, I worry, how many people so of those people who have a family doctor, how many can get to their family doctor in a timely manner? If you pick up the phone and call your family doctor right now, will you get an appointment today or tomorrow or the day after that? Or will you have to wait 2 or 3 weeks? And so that's a big problem. And having more family doctors, my plan, a family doctor for all of us, won't just make sure more of us, all of us, get a family doctor. It will also ensure that those of us who have one don't have, patient lists that are hemorrhaging because there are too many patients. We'll make sure that we can actually see a family doctor in a timely manner. And that is really critically important.
Thanks so much, Adil, for that. Reminder to everyone listening in that you can ask a question as well. You just have to dial *3 and you will be added to the queue to ask your question. Just go ahead and dial *3 at any point in the conversation. We have another question here from Ari, so I'm going to turn it over to Ari. What's your question?
Hi, so I just wanted to know what the current plan is to deal with the Ford government's move towards privatization in the province. Given the amount of time left in this term, I feel that it's crucial that action be taken now before we're in a somewhat irreversible position. I want to know what plans you have to deal with that.
Thank you so much for raising that question, Ari. As a health critic, and wearing my MPP hat, I've been unbelievably active in trying to hold the Ford government to account. I have a province-wide campaign called Patients Not Profits, and when with the province-wide petition, campaign and knocking on doors and all of those kinds of things. When the Ford government came in with this legislation, it's called Bill 60. It's called Your Health Act, which is kind of a euphemism. Essentially, what it promised to do, what it proposed to do, is to move diagnostic services and surgeries out of hospitals, which can already happen. But the purpose of the bill, in my opinion, was to allow those services to happen in private for-profit clinics. And as soon as that happened, I went straight to work. I had a chance to review the legislation to try and institute protections and amendments that would make sure that private wealth didn't come before patient health. I had an opportunity to, I tried really hard to introduce amendments that would prevent people from experiencing upselling and upcharging, which is where you get told to purchase with your credit card things that aren't actually necessary for you. And I tried to protect against, with my amendments, I tried to protect against moving, against nurses getting siphoned out of the public healthcare system because they'd be getting paid more in the private system. And the Ford government, despite all of my advocacy, both legislatively with my amendments, but also all of the work that I did talking to the press, working with the unions, and literally, when necessary, not just giving speeches, but demonstrating in, outside of Queen's Park and all across the province, they forced it through. And I'm not done fighting yet. I helped to lead the charge on the recent Ontario Health Coalition referendum, a citizen-led referendum that I was proud to support across the entire province, where nearly 400,000 people said that they didn't want our healthcare system privatized. Those results, I believe, were just announced yesterday. And we're not going to stop reminding the Ford government of those results and taking the next steps to ratchet up the pressure. Because I agree with you, I am really worried about privatization in our healthcare system because it does leave us behind. Someone earlier in the call made the point that, we want to pay with our OHIP card, not our credit card. And listen, the reality is that when it comes to family medicine, people are already paying with their credit card. Many people who don't have a family doctor are being forced to call like virtual family doctors, in like these corporate setups where you have to pay $60 or $70 in order to talk to the family doctor. I have also been pushing really hard and also working with our federal partners to make sure that the Canada Health Act is protected and that clawbacks are instituted where the provincial government actually has to pay back money because of private inappropriate healthcare that's happened in Ontario. So I've been working really hard on this. We have to keep going. And I say we intentionally. I can't do it alone. I need people like you and all the people on this call to stand with me, to fight against privatization, to fight for a family doctor for all of us. So thanks for sharing that concern.
Thanks so much, Adil. So we have 4,500 of you on the line. Welcome to any newcomers. A reminder that you can, if you would like to ask a question, press *3. You can press *3 at any point to ask your question and be added to the queue. So we have another poll for all of you. And I'm going to ask a question and you can key in your answer. My question is, have you ever had to go to the emergency room because you could not access primary care? You can dial 1 for yes and press 2 for no. So once again, that question is, have you ever had to go to the emergency room because you could not access primary care? You can press 1 for yes and press 2 for no. We're going to go to our next question and we're going to come back and give you the results of this poll after that next question. So a reminder, if you'd like to be added to the queue and you'd like to ask a question, you can press *3. Our next question is from Rosanna. Rosanna, what are you wondering?
Hi. I have a daughter who is 8 months pregnant. We have a family doctor for her, but the family doctor will not accept the baby because, quote unquote, her practice is full. Me as a mother, I'm very concerned because where are we going to go with a newborn? God forbid we need help. Do I go to emergency care? We pay a ton of money through health care. We don't pay it directly, but we pay it in our taxes. We pay it in all sorts of ways. I'm just wondering, what is the government going to do about this? It's something that really concerns me as a mother, as a grandmother-to-be. I have a young daughter, which she's worried. And I think this is a legitimate question because healthcare has become ludicrous. They've cut times for we have to wait unforeseeable amount of time to get an MRI, a CAT scan. What if we need all this? A newborn baby can need a lot of help. How do you plan to work this out?
Rosanna, thank you so much for your question. The first thing that I want to say is congratulations. I know it's a worrisome time for you right now, but I do want to say congratulations that you're about to have a grandchild rather. So a couple of quick things. The first thing I want to get out right away is you can call 811, which is called Health Connect Ontario, and chat with the nurse. Now the reality is I'm hearing from everyone that when they call, this is the Ministry of Health line to get a family doctor. What I'm hearing from people is that they call and they get added to a wait list and they end up waiting for months. But they should prioritize a baby. The other thing is you can have a chat with the pediatrician that comes and checks on your grandchild after he or she is born, and that may be able to help. Obviously, if and when my plan goes through, it'll be dramatically easier in order to be able to have a family doctor or a pediatrician for a new child. But it is a tragedy, and it is sadly a sign of the times that even a brand new baby and the mother and grandmother, of that baby are at their wits' end to be able to find a family doctor. And no one would disagree that that should be an urgent case. But I do say try 811 and do try talking to the pediatrician at the hospital to see what can be arranged. Reflecting on my time as a family and emergency doctor, we will always bend over backwards for a newborn baby and for the patients that need that most, the patients that need it most, which really underscores, after so long through the pandemic, as the primary care crisis worsens, an essential part of my plan is to support family doctors and to work to retain them. Because what I just described, my efforts and my colleagues' efforts to always bend over backwards when the need is the greatest, it's causing people to choose to have to retire early. It's causing people to get burnt out. And the solution that I have will address that. It will help people to be able to stay healthy so that they can work to keep all of us healthy as well. So I hope that gets to the beginning of that issue, and I wish you the best of luck.
Thanks so very much for that question, and Adil for that answer. A reminder to folks that you can press on *3 to ask your question. Just go ahead at any point, you can press *3 and you will be added to the queue where you can ask a question for Adil to answer live. If you don't have time, if we don't have time to get to your question, you'll actually be able to leave a message with your question at the end of our conversation for us to get back to you on. So remember, press on *3, go ahead and ask what you'd like to ask, and we'll do our best to get to your question. Now, before that last question, we asked you if you've ever had to go to the emergency room because you could not access primary care. And this is a striking result. 47% of you said yes, and 53% said no. That is an almost even split. That is something. Adil, do you have any reaction to that?
Yeah, shock and awe really is the best way to describe that. I mean, 47% of people are telling us that they went to an emergency department, had to wait hours in a setting amongst other people who are critically ill, accessing care that they were, I don't blame anyone for going to the emergency departments. When you've got nowhere else to go, that is the purpose of the emergency department. But it's not the, as hard as we try in the emergency department, it can't be the most dignified care. I mean, people are sitting in halls, in chairs, waiting for hours, next to people who are crying, having the worst days of their lives. And every one of those people who's waiting because to see an emergency doctor because they need primary care is, and again, no one can be blamed for this, but increasing the wait time for everybody else. And so, even as an emergency doctor, I mean, when I've done my emergency medicine, so I practiced as an emergency doctor in Toronto as half of my, until I was elected as half of my practice. With the other half of my practice, I was practicing family medicine outside of Toronto in rural and remote communities. I've had a lot of experience both in urban and rural settings. And even then, I have to say, this statistic really surprises me. And it shows just how much things have changed in 1 year alone. 47% of people are turning to an emergency doctor and to an emergency department because they need access to primary care. It really underscores the importance of making sure we get this right, of making sure that there's a family doctor for all of us. And it doesn't make sense that we only make sure that there are enough family doctors in Toronto or Ottawa. We need to make sure that there are family doctors in rural areas to keep our hospitals open, to make sure that people, even in small communities, get access to a family doctor and can get the primary care that they deserve. So it's so important. And this statistic really underscores the importance of a plan like mine.
Absolutely. A reminder to folks that you can press on *3 to ask your question for Adil to answer live. If you prefer not to speak live on the call, that's also okay. You can press on *3 and I am happy to read out your question for you. I talk a lot anyway, so go ahead and press on *3 and we will do our best to get to your question. So we can move on to our next question, which was actually an online submission. And it's from Astrid in Canada. Astrid asks, healthcare is clearly your passion. What motivated you to become an emergency doctor?
Thanks very much for that question, Astrid. I mean, I went into medicine because I want to help people. That's really what it all comes down to. And in emergency medicine, we help people at the darkest moments in their lives. And no matter what comes through the door, we're always able to do something to, we may not always be able to solve the problem, but we make things a little bit better. But if there's one really important lesson that I got from the emergency department, it's that it's the safety net for entire communities. It's where people go when they have nowhere left to turn, when they don't have a family doctor, or when there's been some sort of crisis in their personal lives, even if it's related to lack of access to social services, they come to the ER. And it's actually because I discovered that most of my patients were sick because government wasn't working well for them, social services and public policy weren't working, well for them. I realized that I was slapping a Band-Aid on a gaping wound and that I needed to do more. And so that's actually why I ran for elected office. And so, you asked, why did I, what motivated me to be an emergency doctor? Well, honestly, it was to help people. And now as an elected official, as an MPP, and hopefully, as I go through this exploratory bid to be on, to consider becoming the Ontario Liberal leader, this is an opportunity to help people, even more people, but not with the prescription pad and stethoscope anymore, but using the tools of law and business and policy making to work for all of us. So that's kind of how I got here.
Thanks so much, Adil. A reminder to everyone listening in that you can add yourself to the queue to ask a question as well. You just have to press *3 and we will add you and you'll be able to ask Adil a question. So just press on *3 at any point and we will add you to that queue. I have another question for everyone listening in, and we are going to collect results. My question for you is, if Adil were to run for Ontario Liberal Party leader, can we count on you to vote for Adil to be the next leader? You can press 1 for yes, 2 for maybe, and 3 for no. So once again, that question was, if Adil Shamji runs for leader of the Ontario Liberal Party, can we count on your support? That's 1 for yes, 2 for maybe, and 3 for no. Go ahead and press on that answer whenever. And remember that you can ask a question as well. If you would like, just dial *3. We can move on to our next question, which is another online submission. It's by Bob from Kitchener. Bob says, I am 55 and have diabetes, but lost my doctor during the pandemic. The nearest doctor accepting new patients is 2 hours away. How do you plan to serve remote communities? Adil, what do you think?
Bob, I have to say I really feel you on this question because, as I mentioned earlier, about half my practice for most of my career has been in rural and remote communities, where I've heard and witnessed stories exactly like yours. Have heard the problem of accessing a family doctor in these rural areas, and have been doing my best to be the solution by being that family doctor that comes in. So, I mentioned earlier that we all want a family doctor for all of us. The challenge, however, is that we can't just have family doctors coming to urban centers. We need them to go into every community across the province. And so there are a couple ways that my plan will assure this. The first is we start with a province-wide strategy that looks forward and anticipates the needs even coming years in advance. And we do that by working with regional stakeholders like municipal governments, by talking to doctors and hospitals, and understanding not just where the needs are the greatest, but where they are expected to be the greatest. And we start planning for that. The planning and solutions that come out of the information we get from that plan can take many different forms. I mean, we can increase the number of incentives that allow people to live and settle, that allow more family doctors to live and settle in, rural communities. But I think actually one of the most important things is we need to make sure that our medical schools and our residency programs, which are the educational ways in which we make more family doctors, number one, we need to admit more people from rural areas and make it easier for medical students and residents to train in the places where we need doctors the most. Because right now, like I went to the University of Toronto, I'm a little bit of an odd duck because even though I trained at the University of Toronto, I'm the one that goes up to all of these rural and remote communities. The vast majority of doctors that choose to settle in these communities either grew up in these communities or they trained in these communities. And we don't have enough of a process in place to maximize the training outside of urban centers. And I think that is a really important tool. And then finally, what I will say is Ontario is really unique amongst other provinces in Canada because we really preserve very few spaces for Ontario medical students and medical graduates. And as a result, there are a reasonable number of people who come from out of province to Ontario, and then they return to the places that they grew up or were living in before. And so part of my plan also is to expand the number of spaces that we set aside specifically for people, for medical students and residents who are from Ontario, because we know these are the ones who will be most likely to stay in the places that we need them to.
Thanks so very much for that answer, Adil. A reminder to everyone listening in that you can ask your question to Adil as well. You just have to press on *3 at any point, and we will add you to the queue. There are 4,500 of tonight, and that is so exciting. Thank you for joining this very important conversation. We are going to do our best to get to all of your questions. Please press *3 to be added to the queue. So just go ahead and press on *3 at any point to ask your question. And even if we don't get to you in the hour, we will do our best to send you back a reply. So press on *3 and you'll be able to ask your question. We asked a question to you, which I'm going to ask again. If Adil Shamji runs, can we count on your support? If he runs to be Ontario Liberal Party leader, can we count on your support? You can answer this question by pressing 1 for yes, 2 for maybe, and 3 for no. So we're going to go ahead and keep collecting your answers. So go ahead and press 1 for yes, 2 for maybe, and 3 for no at any point. And I will say once again, if you would like to have your question answered, I know Adil will be very happy to answer it. Press on *3 to ask your question and be added to the queue. Our next caller is Jennifer, who has a question. I'm going to kick it over to you. What's your question, Jennifer?
According to the article, there is 3 in 1 Canadian have mental health issues. So I just wondering, and then there are so many people sleep in the street in Toronto area. So I just wondering, can we increase the monthly money for vulnerable people, or should we have more funding for them, like to solve the problem?
Great questions, Jennifer. Thank you very much for asking those. And you know, let me share something that is incredibly tragic, because Jennifer, you were asking, can we increase the funding for for homeless people and people that need, I think you're talking like things like the Ontario Disability Support Program. Here's the tragedy. So number one, should we increase the amount of money for the Ontario Disability Support Program, because right now it's inadequate and cost of living is out of control? Yes, absolutely. But what we're finding and what I've been hearing is that there are people that need to get access to those programs. And in order to get access to programs like ODSP, the first thing that you have to do is you have to see a family doctor to fill out the form. And going to a walk-in doctor is not good enough, because you need to go to a doctor who understands the health and medical problems that you have. And so right now, there are people that deserve to get access to programs like ODSP that aren't even able to, because they don't have a family doctor in the first place. Now, I want to share that I'm very sympathetic to the concerns you raised, both about people who are experiencing homelessness and also to the statistics that say 1 in 3 people are experiencing mental illness. One of the roles that I had before I became a member of provincial parliament was, in my capacity as a family and emergency doctor, I was the medical director for 11 homeless shelters in the city of Toronto. And I saw what happens when people can't get access to mental health care. They end up disproportionately living on the streets or in homeless shelters, and it's not right. So one of my roles was to bring family doctors and mental health workers and psychiatrists and addictions doctors into the shelters. And something amazing happened when we did that. First, we stabilized someone's addiction, and we learned that they were treating their addiction with things like opioids because they couldn't get access to mental health care, and they were self-medicating with drugs. So once we stabilized the addiction, then it uncovered the mental health challenges that they were experiencing. And when my mental health teams worked with them to stabilize those mental health challenges, we could address their primary care needs. And then this was where the real magic happened. People were able, once all those things were stabilized, they were able to become productive members of society, reintegrate into society, and be able to move into things like supportive housing and hold jobs. And so someone earlier, I think one of the first questions we had said, one of the first questions that came up was, could a family doctor for all of us bring savings to the healthcare system and to the province of Ontario? And the answer is absolutely yes. One of the greatest places to go for mental health support is to your family doctor. And if someone's mental illness and addiction challenges can be addressed by their family doctor, then that source of disability can be taken away. And then they can find their full physical, emotional, and social potential and well-being, and be able to hold jobs, be able to find work, be able to live in homes and move off of the street in the most extreme cases. And that saves all of us money. And as people become even more productive members of society, they can contribute more to society and support all of us together. But it starts with having access to primary care and having a family doctor. That's what I'm trying to deliver.
Thanks so much, Adil, for that answer. Remember, everyone, we're going to do our best to get to all your questions. You just have to press *3, and you'll be able to ask that question that you're wondering about, and Adil will be able to answer. So press *3 to ask your question at any point. I'm going to pose a question to all of you one more time. If Adil Shamji runs to be the next leader of the Ontario Liberal Party, can we count on your support? Please press 1 for yes, 2 for maybe, and 3 for no. One more time, that question for you is, if Adil Shamji runs for the leader of the Ontario Liberal Party, can we count on your support? 1 for yes, 2 for maybe, 3 for no. And for any of you having a question in that head, please go ahead, press *3, and we'll be able to add you to the queue and you can ask your question. Our next caller is Lois. Lois, what's your question for Adil?
Good evening. I'm calling from Coburg. A friend of mine's son has cancer, and because he was self-employed, he has been told that he will not get any government funding at all because he did not pay into unemployment insurance. Is there any place or anyone he can contact to get a little help? I mean, he's going to be off for a good year or more. Thank you.
Thank you. Yeah, thank you very much for that question, Lois. I mean, in situations like this, one of the best places to turn is to a social worker. So if we were in Toronto, it would be easy to say, you could call 211, and that usually will get us access to people who can help us navigate social services, and ideally a social worker that can help to navigate that. I'm not sure if that number works in Coburg, I'm afraid. So in this setting, I suspect that perhaps one of the best things to do might actually be to contact your local member of provincial parliament, who can help to point you exactly in the right direction in order to solve that. Now, what I would say is fast forward a couple of years, and if we were successful, when we are successful in delivering a family doctor for all of us, a really important part of the plan is we're not just talking about family doctors only. We're talking about teams of primary care that come with nurses, nurse practitioners, and most importantly, for this question, also with social workers. And so if a case like this were to come up, there would be a team of people that could support your friend's son and help help him to get access to the care and the funding that he needs. But for that specific case, I'm not 100% sure because I'm not aware of the specific resources in Coburg. What I will say, earlier I said, you could consider contacting your MPP. Well, you could also just email us, info@joinadil.ca, and we will do our best to point you in the right direction, Lois.
Amazing. Thanks so much, Adil. So we asked you folks a question, and you folks responded. We asked, if Adil Shamji runs to be leader of the Ontario Liberal Party, can we count on your support? And 96% of you answered yes or maybe. That is an astounding number. Adil, do you have any reaction to that number?
I mean, it's an unbelievable honor to hear a number like that. What I will say is, when I think about leadership, it's very much an act of service. When I see a number like 96%, what that tells me is people are asking me to get to work. When I think about my conception of what it means potentially to be an Ontario Liberal leader, it means standing up for things. It means standing up for not just for things, but for values, and in this case, standing up for primary care and family medicine. And that's what I want to do. That's what I intend to do. And it's an incredible honor to hear that perhaps that 96% would be willing to and trust me to stand up for and to fight for something like this.
Thanks so much, Adil. I think that we have time for one more question here that was submitted online from Jasmine from Toronto. Jasmine asks, what are some barriers in the system you see around women's health and women's access to primary care, and how does your policy support them?
Well, I think we heard a really important example of barriers to primary care for women earlier. I forget our caller's name, but she was describing her daughter who is pregnant and about to have a child. And while she has care for herself, she can't find care for that future child. That is absolutely a problem, and it's a travesty in our province, in one of the most developed countries in the entire world. And so, it's really important that we have family doctors that look like all of us, that live where all of us live, And that's really what this plan aims to deliver. If we can get that right, then we will have people in the right places with the right background who look like us, who can help with women's health, who can help with obstetrical care and the unique needs that women have. And so the prerequisite for that, the first step for all of that, is just to make sure that there is that family doctor in place.
That answer, Adil. And I just want to say a big thank you to all over 4,500 of you who joined us for the full hour and participated so actively in such an important topic and such an important policy issue of today. I'm sorry that we could not get to all of your wonderful questions, but I have good news for you. You can still ask your question, and we will do our best to get back to you as soon as we can. You just have to stay on the line and leave your name, email, or phone number, and we will get back to you. So remember, go ahead and leave a message, leave a recording with your contact info, with your question, and we'll get back to you. If you support what you heard tonight, we want to hear from you, and you can keep up to date on our campaign by visiting joinadil.ca to learn more, or you can follow Adil and our campaign team on Twitter at Shamji Adil. Thank you so much again to all 4,500 of you who joined us tonight. Have a wonderful night, and we will speak with you soon. Adil, did you have any closing remarks before we jump off the line?
Yeah, I just wanted to say thank you to every single person on the line for sharing this hour in this beautiful Thursday evening with me. It is really important, not just for me to come forward with proposals in response to the challenges that everyone is experiencing, but it's also really important to listen. And so I thank all of you for giving me that opportunity to listen, to help me better understand the challenges that we face across our great province, and for giving and for sharing with me that incredible mandate of 96%, stating that they could believe in me as a future leader. I thank you for that, and I recommit to working as hard as I can for all of us.